As I've already mentioned, this morning I attended National Cabinet where leaders were given an updated briefing on the threat posed to us all by the Omicron variant. What we were told is concerning. The picture that is starting to emerge is troubling. But there is hope and there is help. It comes in the form of vaccination, specifically the third dose, which health advice shows is far more effective against the Omicron strain than 2 doses. Therefore, we are now announcing changes to our vaccination program, specifically in relation to third doses. A third dose of the COVID-19 vaccine will now be mandatory for all eligible workers in industries covered by a vaccine mandate. This means under the mandate, workers will now be required to have a third dose within 1 month of becoming eligible. Currently, more than 266,000 people are eligible for a third dose, and so far, 89,927 people have received their third dose. Everyone is strongly urged to receive a third dose when eligible, even if they're not covered by this policy. I repeat, we're trying to boost the number of Western Australians who will get their third dose because the health advice confirms the extra dose is far more effective against the Omicron strain compared to 2 doses. Now, ATAGI, the Therapeutic Goods Administration, is set to make a decision on the timeframes in coming days. Currently, people are advised to get their third dose 5 months after they have received their second dose. Hopefully, ATAGI will reduce that timeframe. You need to start thinking about booking a third dose as soon as possible before Omicron comes into our community. Our state clinics will continue to operate over the festive season so people can go out and get vaccinated. People should visit the Roll Up for WA website for their most convenient location. Vaccines are available at state-run clinics, GPs and pharmacies. As of today, Western Australia's vaccination rate for 12 plus is 90.9% for the first dose and 82.7% for 2 doses, and climbing each and every day. We're still preparing to enact our Safe Transition Plan on Saturday, February 5. I previously stated this is locked in, barring a catastrophe. I've also previously stated that we are obliged to listen to any updated health advice to protect Western Australians and keep them safe. Our plan to safely transition our borders on Saturday, February 5 involves baseline public health and social measures designed to minimise any spread of the virus once it arrives here in Western Australia. I want to emphasise that those measures can be scaled up at any time, depending on the severity of any spread and the consequent level of risk. Any decision will be focused on the safety of Western Australians, and any decision will be based on the most up-to-date health advice. This is what we have consistently done since the start of the pandemic. This is what has served us so well in keeping Western Australia safe and strong. Whatever challenges we may face from the pandemic generally, and the Omicron variant specifically Western Australia is in the best position possible to prepare for the arrival of the virus. We're in the best possible position to monitor what is unfolding over east and across the world. Being cautious has served us well. Our vaccination rates are improving. But as I've said before, the virus will find those who are not vaccinated. So please get vaccinated. Make sure your family, your friends, your colleagues get vaccinated. The ICUs in the east are full of the unvaccinated. It's the best weapon that we have to keep each other safe. I'll now take any questions.